is no pressing question, let's invite Professor Jeewan Titiyal here, and thank you, Maipal, once again.
Thank you.
Thank you, Abhay, for a kind invitation. I hope my slides are visible. And like to thank AIOC, especially Professor Namrata Sharma, for putting me into this very exciting morning cataract session where we had a terrific international people talking to us. Today, I'm going to talk about something new which we have documented in print on a posterior polar cataract. No financial disclosure from my side for this particular talk here. Looking into a concept of posterior polar cataract surgery, we all understand we have to do a slow motion phaco. Rhexis is a very important part in safeguarding the posterior polar cataract in terms of implantation of a desirable IOL and getting the safety of nucleus emulsification done in these cases. We all understand that Rhexis size should be around 4.5 to 5 millimeter. Therefore, in case you have lost the support of a posterior capsule for implantation of a single piece lens or a foldable lens inside the bag, then as we discussed, a 3-piece lens can be safely implanted in the sulcus and get the optic capsule in the anterior rhexis. We normally don't do hydrodissection in all these cases of posterior polar cataract, which is a standard dictum in our posterior polar surgery. We do a delineation like you saw here. We do a one delineation. Subsequently, rotation should also be avoided in these cases because you are not sure if your posterior capsule is strong enough to resist the rotation in initial phase. And the phaco should be, as your parameters should be as moderate as possible because most nucleus are softer and they can easily be done with a chip and flip technique like I'm doing here. Central bulk is being reduced so that you can simply take away the cushion of a nucleus, which is very safe to remove in these cases. In fact, you can see the phaco part may be very minimal in these cases because sometimes your phaco can go through and through in a soft cataract. This nucleus core can be simply rotated without disturbing the epinuclear cortex. You can see epinuclear cortex very safely there. Now we take out the epicortical nucleus. If that is done, the things are simpler. In the middle, you can see a defect type of appearance, which sometimes we feel that this may be the opening in the posterior capsule, which normally may not be. And most people would realize that once you remove the epicortex, the posterior capsule may still be clear. So this opening sometimes gives a jittery feeling on the table that your capsule may be totally open and things can be very difficult. Like you saw here, the things were absolutely all right. So this is what we have described in 2021, intraoperative posterior polar cortical disc defect, sign of intact posterior capsule in JCRS last year, which gives an idea that how your posterior capsule will behave in these cases subsequently. The defect sign was seen in almost 87% of cases. And in 93% of cases, the disc was complete, like you saw here. In around 7%, the disc was incomplete because in the process, you could have aspirated the cortex in those cases. What stage these PPC DD sign comes in a posterior polar cataract? After the epinuclear plate aspiration, almost 90% of cases, you see this disc defect. Around 8% you see after the complete cortical aspiration also. Rarely you see after the nucleus emulsification, that is before the epinucleus aspiration, here around 2% of cases. So if you look into this, if you have a PPCD sign not seen in these cases, we had 9 patients out of 70 cases. So these cases will have a higher chances of addition of a cortical or epicortical complex into the posterior capsule. And the chances of a rupture of capsule becomes higher in these cases. Around 44% of cases that posterior capsule will open up. So if you don't have a sign during a surgery, then there are more chances of posterior capsular defect happening in these cases. This is another case to highlight the entire aspect of posterior polar cataract. You can see this is IOCT microscope showing that very nice delineation being done in this patient. Subsequent to decompression, the entire nucleus can be emulsified routinely. and leaving the posterior epinuclear cushion intact till the end of surgery in these cases. You can see this defect has come up as I was trying to remove the epicortex of cushion in this particular case. But we know that this is the posterior polar cortical disc defect, which may give a sign that capsule is intact, which can be seen in the IOCT here. You see the capsule can be easily seen very classically intact in these cases. So this sign is one which makes surgeon more comfortable during your surgery. We have described the intraoperative OCT guided classification of grade 1, type 2, type 3, type 1, type 4 being the open capsule, what Dr. Vaipal talked about. Type 2, where you can't see the posterior capsule cleanly in these cases. Type 3, you can't see the entire length of posterior capsule is not seen in the beyond the disc in these cases. Just to highlight in what stage and what type of posterior polar cataract we see a disc defect. This is a type 2 posterior polar cataract, where you can see we are doing a delineation. You can see the delineation happen here. And after we do a nucleus emulsification in this case, you can see we have intact epinucleus in type 2. Once I remove the epinucleus, then I see the defect in the cortex. So this defect comes as a cortical aspiration time in type 2. Well, type 3, where we have a large disc and nucleus is harder, in those cases, the defect is actually seen immediately after nucleus aspiration, nucleus emulsification. You can see the epicortex is intact, you have a defect here. So we can also classify the type of posterior polar by the disc size we see in these cases. To summarize, we all understand posterior polar cataract demands a separate understanding of a phaco. Slow motion phaco can be desirable in these cases, layer by layer removal of cortical nucleus and cortical cushion. And if you see the posterior polar cortical disc defect, it's a safety sign for posterior capsule. If you don't see it, then it's a higher risk for posterior capsular opening in these cases. People, if interested, they can see our publication in JCRS, which explains the entire aspects of posterior polar cataract. Thank you for kind listening and giving opportunity.